If you have ever wanted to know how to check your blood pressure using the manual method and the digital method, this video is for you, and this is the model I am going to be using. First, we are going to be starting with the blood pressure. What is blood pressure? Blood pressure is the force of blood against the arterial walls, and we are going to be using two methods to check the blood pressure, which is the palpatory and auscultatory method, that is while using the manual method. But when using the digital method, you don't need to bother with the palpatory and auscultatory method. It might interest you to know that when checking the blood pressure, using the manual method gives you a more accurate reading when compared with the digital method, because why not? The digital method is just like using a digital monitor to check your blood pressure. So this is the digital monitor used in checking blood pressure. The digital method is actually very simple when compared with the manual method, because it just requires you to apply this cuff directly on the upper arm of the patient or wherever you're checking the blood pressure. When you apply the cuff directly on the upper arm, you have to connect this to this part of the monitor. And immediately you're done applying the cuff directly to the upper arm, then you click on start. This helps you get not so accurate reading, because when compared with the manual method, it gives a more accurate reading. But I'm going to be elaborate while educating you on how to use the manual method. Like I said earlier, using the manual method involves you using two major steps, which include the palpatory and auscultatory method. The palpatory method requires you to feel the pulse without using the stethoscope, and it helps you to get an estimated systolic reading, while the auscultatory method requires you to use the stethoscope to hear the heart sound. Using the palpatory method, you have to feel a pulsation at the radial artery. You have to place two fingers on the radial artery, that is after applying the cuff. When you apply the cuff, you place two fingers on the radial artery. When feeling a pulsation, you begin to inflate. At a point where you stop feeling this pulsation, it is regarded as the estimated systolic pressure. Before checking the person's blood pressure manually, you must make sure that the person is already calm and relaxed. Because in a situation whereby the person was running or the person has been in a strenuous exercise, that can actually increase the blood pressure and it will not give you an accurate reading. So in this situation, you allow the person to stay calm and relaxed for about 30 minutes before you begin checking the blood pressure. So she is already calm. Then when checking the blood pressure, you have to keep the arm at the heart level. You begin to apply the cuff directly on the upper arm of the patient or the person. I've already tied the cuff, not too tight, not too loose, directly on her upper arm. So I have to locate the brachial artery. This is where we have the brachial artery at the antecubital fossa. Now, remember, we are using two methods, which is the palpatory and auscultatory method. Like I said, the palpatory method requires you to feel a pulse when inflating. Now, we are going to be using the radial artery because it's most recommended. Remember, when I did a video on the skeletal system, I talked about the radial bone and the ulna. The radial bone is where we have the radial artery. This is the radial bone, the one pointing directly to the thumb. So it's basically that is where we are going to find the radial artery, at this site. You place two fingers over the radial artery. Please don't use your thumb. The thumb already has its own artery and you can feel it pulse with the thumb. So use your two fingers, place it directly on the radial artery. When you start feeling a pulsation, you begin to inflate the bulb. At a point where you stop feeling this pulsation, it is regarded as the estimated systolic pressure, because as you are inflating the bulb, you are applying pressure on the arteries, and at the same time you are squeezing these arteries, thereby reducing blood flow to this part of the arm. So you have to be as fast as possible. Remember, when inflating, if you stop feeling a pulse, you should mark the area where the pointer is pointing at. If it is at 120, it is regarded as the estimated systolic pressure. Then you apply an additional 10 to 20 millimeters of mercury for more accurate reading. I've already started feeling a pulse in her radial artery, so I'll begin to inflate. But in a situation whereby you are inflating up to 200 millimeters of mercury and you are still feeling a pulse, it means that the person's blood pressure is very high. Even after squeezing and applying pressure in the artery, you're also feeling the pulse. It means that the pressure of blood is very high. So I'll begin to inflate. And when inflating, make sure that you are looking at where the gauge is pointing at. I stopped feeling a pulse at 120, so it is legally accepted that I add an additional 10 to 20 millimeters of mercury for more accurate reading. I am done using the palpatory method, so I am going to be using the auscultatory method, which require me to use the stethoscope to confirm, because the palpatory method just gives us an estimated systolic reading. So I have to place the diaphragm of this stethoscope over the brachial artery. But when placing it, you don't use your thumb to hold it because, like I said, the thumb has its own artery. You place two fingers this way to get a more accurate reading because the arteries and the finger can interfere with the reading. Then you begin to inflate. It is expected that you hear the first sound, the area where you heard the estimated reading. So I heard the first sound, which is the systolic reading, at 110 millimeters of mercury, while the diastolic reading was at 60 millimeters of mercury. So this diastolic reading is when the heart is now relaxing. So this is the last sound you hear while checking the blood pressure. So the auscultatory and palpatory method helps you to get a more accurate reading in cases where you are finding it difficult to get an accurate reading while using just the auscultatory method. So after doing all this procedure, you untie the cuff. So if you have any question as regards to how to check your blood pressure, whether manually or digitally, you can drop that in the comment section. And remember, you should know how to check your blood pressure. You should check that always because you never can tell when you have a low blood pressure or a high blood pressure. Because once it occurs, you can either collapse without even knowing. So if you have a question as regards to how to check the blood pressure manually, you can drop that in the comment section.